Welcome, welcome. How's everyone doing? How was lunch?
Good.
Good? That's good. Anyway, so we're going to start here with 5 minutes past the time. We're still expecting some guests to come in, but we're going to start now and then we'll see how the rest of the day goes. So welcome to the Human Rights Day Convention Cafe. I would like to acknowledge that we lead work on Treaty 8 territory. We respectfully acknowledge we are meeting on Treaty 8 territory. We honor the traditional lands of the First Nations, Métis, and Inuit peoples who have lived, traveled, and gathered here for thousands of years. It is their footsteps that have mapped these lands before us. Let us together steward these lands today and for the future. It is a privilege to welcome such a diverse and engaged group to this event. For those of you that don't know me, my name is Dengo Gogo. I am the president of the Multicultural Association of Wilberforce. And for some of you in this room, you know me as O'Reilly's mom. And that's good. And other people know me as a lawyer, or Joshua's wife. And I'm proud to be that, and I'm proud to be here today. So December 10th is when the world observes Human Rights Day every year. So we are 9 days ahead. So we can continue from today until the 10th and every day of the year understand what human rights are. It is a day established by the United Nations to commemorate the adoption of the Universal Declaration of Human Rights in 1948. This declaration is a cornerstone document that outlines the inherent rights and freedoms every individual is entitled to, regardless of their race, their religion, their gender, or their background. To start, before I continue on, but we would like to start with a blessing, and I'm going to call on Elder Lorraine Albert to give us a blessing.
Thank you. I'd like to ask you all to stand, please. And if you're wearing a hat, can you remove it just for while we pray? Thank you. Before I start, I want to tell you where I'm from. I'm actually from northern Saskatchewan, from a small town that's basically a ghost town. I come from Uranium City, Saskatchewan, and it's at the end of this river, Athabasca River, and at the other end of Lake Athabasca. So that's where I'm from, and I'm Dene. And while I'm really pleased to be invited here, and while I was sitting over there in the dark, because I can't stand the light, now I lost my website, honest to goodness, I was looking up the definition of Human Rights Day. And under the Government of Alberta's website, they have a special category there for Indigenous people. So I encourage you all to read that and think about it, because as an Indigenous person, we're often not privy to having human rights. And it might sound kind of odd to some of you because you think that you're in Canada and that everything is fair, and it's quite often not fair for our people. So just think about that and read up on it. And I'm really pleased to be here. I'm grateful for the food that we ate. And I find it so hot in this room. And now my face is going to get all red. And I'll ask you all if you could pray in your own way, in whichever way you know how to pray. And I'll pray and encourage you all to think about the true meaning of Human Rights Day. Thank you, Creator, for bringing us together today to discuss the topic of human rights. Creator, help people to realize that the indigenous people in this country don't have the same rights as everybody else. Creator, help me to be a kind person in my thoughts and in my words. Help everybody in this room to respect one another and to treat each other with kindness and love. Creator, help us to always realize that it's a privilege to be here in a free country. Creator, give us all the strength that we need to go about in our daily lives, to help each other, to help other people, and to help those that are not as fortunate as we are. Creator, bless everybody here, their families, their little kids, and their pets, and everything that's meaningful in their lives. And help everybody to be grateful for what they have, to be alive, and to have a good life. Thank you, Creator, for bringing us together so we can discuss this important topic. And I'm ever grateful to be here. Marci Cho.
Thank you so much.
Oh, you can sit down.
Thank you so much, Elder Lorraine. It's always a pleasure to have you. As we gather today, we are reminded of the enduring importance of these rights in our world and in our own community. Human Rights Day calls on all of us to reflect on the principles of equality, dignity, and justice, and how these values shape the lives we live and the communities we build. This year, our theme is Rights to Physical and Mental Health. Health is fundamental to human dignity and well-being. It affects every aspect of our lives, our ability to work, learn, connect, and thrive. And yet, for many, this remains unfulfilled due to barriers such as access, stigma, and inequality. We just heard from Elder Lorraine and how our First Nation people, Indigenous people, don't have the same rights as we do. And we know even in our community is a big issue for people of minorities and our Indigenous people to have access to health services. It is a real thing in our community here. It's not something we read in the news, it's something we live with every day. And each one of us here today has a responsibility to fight for the rights to health, physical and mental health. Today, through open dialogue, we aim to explore this critical topic that's sometimes avoided. Together, we'll hear from local voices who will bring insight and lived experiences to this conversation today. We'll discuss what the right to health means in practice and how we as a community can work together to support physical and mental health for everyone. At the Multicultural Association of Wood Buffalo, we believe in the power of conversations like this. We can't hide behind these things. We have to talk about these things. We have to address the issues. And I love seeing the young people. I always say that. It is important for each one of you to be here. It's not the work of your parents. It's not the work of your teachers. It's not the work of your government. It's your job to make sure that everyone has equal access to health services, right? Equal access to physical health and mental health. We can see in the news, we can read all those things, but we know a friend, we know maybe us that's suffering. It's easy to see physical ailment, but it's so difficult to see mental ailment and recognize that that person has a right to access medical services as well. So it is for each one of us to fight for those rights. No one is going to fight for you. You're not voting in the government to fight for you. You're fighting for your health. So There are seeds that are going to be sown today. Seeds of understanding, collaboration, and change. By engaging in meaningful discussions, we can only deepen our awareness and also take steps towards creating a community that honors and upholds the rights of all its members. As we begin today's event, I encourage you to listen, be attentive, and be attentive in your listening, and ask questions. No question is stupid. Every question is valid. No matter what it is, ask questions. Always be curious. And share your thoughts. Don't be afraid to speak, because it may be one sentence that you make that makes a difference in someone's life. So don't be afraid to speak. Speak whatever you have on your heart that comes to your mind. Be bold to speak. We're all free to speak today. So thank you again for your presence here. Thank you for bringing your curiosity. Thank you for your commitment to advancing human rights here in Wilberforce and beyond. Let's dive into our conversation, and let's make today a step forward towards healthier, more equitable world for everyone. Today we stand here alongside the essential values that hold us together as a community. Human rights are the foundation of a just and equitable community. They remind us that every individual, so each one of us, no matter what our race is, no matter our gender or how we identify, no matter the background that we come from, no matter our family background or historical background, or any other factor, everyone deserves respect and dignity. And that's what we're going to discuss today, how we can have this conversation and how we can make our community here more equal and give people more access to health. So before we start, we're going to get greetings from Mayor Bowman, who sends his regret and is not able to make it today.
Good afternoon, everyone. It's Mayor Sandy Bowman here. My regrets that I cannot join you in person for today's panel discussion in recognition of Human Rights Day, which takes place on December 10th every year. Before the proclamation, I would like to thank the leadership and team at the Multicultural Association of Wood Buffalo for holding today's event, and also for your commitment to enriching our diverse region every day of the year. Understanding, upholding, and promoting the principles of human rights for everyone is an important part of this commitment. We thank you for it, and we wish everyone the best as you discuss today's themes, rights to physical and mental health. Both these things are integral on both a personal and community level. By working together and having positive dialogue, we can build a region where rights are respected and everyone has the opportunity to succeed. Thank you for being here today and for all you're doing to help us in this journey. With that, I'll now make the proclamation. Whereas Human Rights Day is observed every year December 10th in the region and in Alberta, Canada, and around the world. And whereas human rights principles are enshrined in the Constitution of Canada, which includes the Canadian Charter of Rights and Freedoms. And whereas acknowledgement of human rights recognizes the importance of individuals and groups that are more vulnerable in society. And whereas Human Rights Day is an opportunity for people, institutions, and all organizations to recommit to the principles that all people are equal in dignity, rights, and responsibility, regardless of race, religious beliefs, color, gender identity, disability, age, ancestry, place of origin, cultural practices, sexual orientations, or otherwise. Now therefore I, Sandy Bowman, Mayor of the Indigenous Power Buffalo, hereby proclaim December 10th, 2024 as Human Rights Day. Thank you, everyone.
Thank you to Mayor Sandy Bowman for that speech and proclamation. Who will now call us Dr. Patel.
Please forgive me for my child. She's a little hyper. She just woke up from her nap, so she's a little hyper. But I'd like to thank everyone today for inviting me here to talk about your healthcare rights and the ongoing challenges of healthcare inequality in rural communities. In Canada, healthcare is considered a fundamental right protected by the Canadian Health Act. This legislation ensures that all Canadians have access to essential healthcare services that are universal, comprehensive, accessible, and publicly funded. Some of your key healthcare rights under this act include access to essential health services, affordability, quality of quick care, and protection from discrimination. However, despite these rights, there are still significant barriers that prevent equal access to care, especially for those living in rural areas. I've spent the last 12 years studying and working in healthcare, with the last 5 years dedicated to serving the community of Fort McMurray. My experience there has been especially meaningful as it has allowed me to see firsthand the challenges faced by a community like ours, particularly in accessing healthcare services. To put into perspective, over 18% of Canadians live in rural and remote areas, and for many of them, healthcare access is a significant challenge. Today, I want to discuss the inequality of healthcare that I've observed in rural communities like ours and how these challenges are affecting people's health. The most significant issue we face in Fort McMurray is limited access to healthcare. This limited access is often linked to socioeconomic and geographic barriers that we experience in our community. In Fort Mac, we deal with extreme weather conditions like wildfires, floods, harsh winters, and even occasional earthquakes. These conditions make transportation difficult, and with only a few healthcare facilities and professionals available locally, residents are often forced to travel long distances to get the care they need. This not only delays treatment, but adds financial and logistical burdens for families, many of which are already facing economic challenges. Moreover, healthcare services in Fort McMurray are struggling to keep up with the growing needs of our population, from a shortage of family physicians at the primary care level to the lack of specialized services like mental health support, NICUs, and other critical care. Many essential health needs are going unmet. This leaves our community underserved and vulnerable. As a result, emergency services become overloaded, and which increases the ER response times and further risks the health of those in urgent need of care. Another key factor contributing to limited healthcare access in rural areas is the shortage of healthcare providers. Rural communities face difficulties in attracting and retaining skilled professionals, such as doctors, nurses, and specialists. The main reasons for these include lower salaries and fewer opportunities for career growth, making rural positions less appealing to healthcare workers. Additionally, many healthcare providers in rural areas experience professional isolation. They work in smaller teams with fewer colleagues to collaborate and support them. This isolation can lead to burnout, which only makes it harder to retain healthcare professionals in this town. These challenges create a vicious cycle of healthcare inequality. The lack of healthcare professionals, combined with the economic difficulties faced by our rural residents, make it even harder to improve access to care. As a result, the health outcomes for our community continues to worsen, and the cycle continues. Addressing these issues is critical to ensuring that everyone, no matter where they are, where they live, can access the care they need. Thank you for listening, and I hope this has given you some insight and the healthcare challenges our town faces today, and maybe we can come to a solution in the future with our new youth. Thank you.
That was amazing. Thank you so much, Dr. Patel. Okay, so we're going to start our human rights panel discussions now. I would like to invite our esteemed team of panelists and the moderator to take their seats. So you can come on the hot seat. So while they're taking their seats, just a reminder again that the theme for this year is the right to physical and mental health. So remembering that we all have the same rights, and so irrespective of your physical disability or mental disability, that you have the right access to health as well. Thank you everyone for joining us. It is a privilege to hear about their experiences. I'm looking forward to hearing everyone speak today and share what their experiences are and what we can do, that we come up with solutions that we could use in a community to have better rights to physical and mental health. I would like to thank everyone again for coming for this discussion today, and feel free to speak and ask questions as you will. And I want to just say that my heart is warmed to see so many people here today, especially the young people, because I love the youth, but so many that want to advocate for human rights. It is important that we advocate, that we don't sit down, we don't slumber, we don't sleep, that we work every day hard to make sure that our rights and our human rights are not trampled upon, that we can avoid things that will limit our access to justice, our access to health care services. Like you heard from Dr. Patel, our community is in their need of a change so that we can fight for the rights that we deserve as people in remote rural community. We are equally Canadians and should have equal access to health services. So I'm hoping that these discussions today will come up with something that we can take back to Mayor and Council and make sure that something is changing. And other health services as well. So I want us to come up at the end of today to come up with something that we know that we can go back and continue to advocate for. So I would now like to pass the mic to the moderators, Medunity youths, and they will introduce themselves and plus the panel.
Thank you, Ms. Dango. Welcome everyone to the 2024 Human Rights Day panel discussion. My name is Nishka Rai, and I'm a grade 12 student here today to introduce Medunity. I'm also joined by Shrishi, Tanya, Lalithia, Pernika, and Naya. And through Medunity, we are dedicated to promoting health awareness. Our goal is to ensure that everyone, regardless of age, has access to the resources and knowledge they need to support both their physical and mental well-being. To us, health isn't just about curing illnesses or managing symptoms, it's about making sure that everyone has the opportunity to live a full and happy life, supported by good healthcare and a healthy mindset. That's why we feel like it's so important to focus on advocating for health across all age groups. Everyone goes through unique challenges, and that can be through whether a young person's trying to figure out school stress or a senior trying to stay active. And so that's why everyone deserves the right to live free from the barriers that prevent access to proper care and support. Health disparities exist, and we must address them, because when people aren't able to get the care they need, maybe due to economic, social, or cultural reasons, it affects their entire quality of life. And so we're also really excited to be here with the Multicultural Association of Wood Buffalo, the panelists, Dr. Patel, and everyone else that made this event possible. This event is a chance to learn and share ideas about what human rights in healthcare really mean. These individuals will come from different backgrounds with different life experiences, and so I encourage everyone to participate in discussion during audience questions and to really hear and understand the positions of all panelists. As we go through discussion, I would like everyone to keep in mind that human rights are not rigid, abstract concepts, but rather, human rights are the foundation of our shared humanity that's determined by us.
Today, our theme is rights to physical and mental health. us youth will be moderating the questions for the panel. Each of us will ask a question, but we will start by asking the panel to introduce themselves first, and we will start the conversation right after. Now I'd like to give a chance for each of the panelists to introduce themselves. Start?
Yeah.
Hello everybody, my name is Mardi Getty and I sit as the board chair for the Center of Hope. I also am a mother of a high school student and I'm the daughter of an aging senior, and my family has been in Canada for over 200 years.
Good afternoon, everyone. My name is Amaka Chijioke. I work as a mental health therapist with Alberta Health Services. I also have my own practice, personal practice, and personally, mental health is something that every one of us needs to be aware of because we all come from diverse culture. We have different traditions, we have different ways and mechanisms of understanding ourselves, but the greatest thing that you can do for yourself is, attaining the knowledge of your wellness, and that's what this is all about. So I'm privileged to be here. I also want to say a shout out to my husband, who has graciously been able to permit me to be here today, and my kids. So thank you all. Oh, sorry.
Hi everyone. My name is Cecilia Sera. I'm a respiratory therapist and a certified educator. I have a lot of years of experience. I'm not going to give you the number now. And I'm a mother of two. I also have a mother who is aging and my in-laws as well. I think it's important that we discuss about human rights and this time mental and physical, because we need to be informed about, especially in these times, about the free consent to access all these medical services and the procedures who are laid down most of the time by law, but also as a professionals. We need to involve ourselves more as a professionals, healthcare professionals, in what is going on right now in our medical services.
Hi everybody, my name is Maxson. I'm born and raised here in Conakry. I'm First Nation, I'm from the Mikisew Creek First Nation. My background is social work. I am the vice chair of Some Other Solutions, which is mental health support in the community. I believe that in this time and age, when we face the challenges of mental and physical health, that we need to learn to be our own advocate. And I'm excited to be here to share this table with all these wonderful ladies.
Hi everybody. My name is Lebang Kolagano. I currently work as a career and employment consultant at Alberta Supports, which is formerly Alberta Works. I'm relatively new to Fort Mac. I think this is a year and a half that I've been here, so I am in true typical client for Multicultural Association. I'm very happy to be here to discuss this topic that we hardly ever get into, but it's very important for mental health and physical health issues. Thank you for having me.
Thank you everyone for your introduction. Now we will come to the question and answer part of our session. So throughout the session, we will present some thoughts and ideas on the health challenges faced by different age groups in our community. And this will help everyone to understand the importance of health rights and discuss some possible solutions to addressing these challenges. So if anyone has a question throughout the discussion, please raise your hand and we'll get through them. But we'll start with the first question for the panelists. So what are some of the most common barriers people face in accessing healthcare? And how can our community address these challenges effectively in order to promote the right to physical and mental health? I'll pass it over to whoever wants to start.
Hi, again, it's Marty. And so I'd like to speak on behalf of the Center of Hope for this question. Just so that everybody understands, sitting on the board of the Center of Hope is a governance position. It's not an operational position. So I'm not fully in the field. However, most of the information that I'm discussing has been taken from multiple of the workers. So in regards to the question, a lot of the patrons that come into the Center of Hope have very complex health needs, layered with very complex mental health disorders. They require very specialized care. They're limited in lack of ID, lack of health cards, but fear and shame often will go above and beyond that. Some of the things that they talked about, we do have our own outreach program, but would be something that could come into the community where we could meet people where they're at, where it wasn't just the Center of Hope itself, but some sort of AHS, something along those lines, where they could have trauma care providers that are informed to ensure patrons feel safe and respected.
Thank you.
I basically agree with some of the things, most of the things she said, and I would also add that looking at it culturally as a mental health therapist, a lot of people come in with various problems, ideologies about the way they see things concerning mental health, and one of those problems could be like stigma, seeing mental health as a stigma. That's like really huge. So first of all, we go into the definition of what is mental health. What does mental health mean for you guys as a person, as individuals? And mental health has to do with basically our core beliefs, our values, how we see life, how we face things from different perspectives. So if we come from a culture where people see mental health as a stigma, like as an illness, then it becomes a huge problem. It becomes a huge barrier. Because then coming to assess, cures and ways to solve those problems can also become an issue with them. So what we say is, like, what do you generally believe as a person? Is it your cultural base? Is it like talking about your health? Is it like talking about your religion? How are you able to present this? Are there some ways that you can, challenge yourself to look at things in a different light? Because when we say there are some problems, there are also solutions to the problems. So when we talk about things like language, we talk about easy access to our healthcare, right? Basically, some of us come from different cultures, especially where in a place like Fort McMurray, you go to maybe probably the hospital, where I also work from time to time, and I also have to see patients come in, maybe crisis or something like that. They don't speak English as their first language. We have a lot of healthcare providers that are not dual in language, so that becomes a big barrier. Sometimes if you look at income, that becomes also a problem, because you see, some people need therapists outside of the core healthcare sections, and they don't have the funding, they don't have the money, they don't have the wherewithal to be able to provide those things, and they don't even have the money to even transport themselves from one place to the other. Like our co-panelist said, she just arrived at Fort McMurray a couple of, just almost a year ago. Like, if you're coming from places from BC, it's a bigger city, you have more variety, you can go to different hospitals. But here in Fort Mac, we have one hospital. I had a situation a couple of years ago where I personally had to take my child. She was flown from right here to Edmonton because we didn't have enough providers. So going back to what Dr. Patel said at the beginning of her introduction, she also buttressed on the fact that, look, we don't have healthcare providers. We don't have adequate doctors here. A lot of people are flown daily from the hospital to Edmonton, to Calgary and other places because we don't have adequate providers. So these are some of the things that are lacking here, and those are the things that are barriers to our health care.
My opinion in that matter is, like, I'm gonna speak on the physical health, because that's where I work as a respiratory therapist in a private clinic. I think most of the subjects in this have been touched by Dr. Patel. And just to remind, is like availability, not only as the number of professionals in healthcare, but also schedules. We have different schedules in the city, and then sometimes the service are only provided Monday to Friday. Some people really need an extension during like after hours or during the weekend. That is a big issue. That is one of the reasons for why people need to travel some to other places. The cost associated with the attention as well. It's increased not only like traveling, but food is also very expensive, gas, and those are the barriers we have with access to medical health. Also, I think like our health system is basically assistential. That means is you get sick, you get attention. Then our primary care, which is very, very important because that is the first step in people getting access to education about taking care of their own health. What are we can provide them with tools how to take care of themselves are not there. Like primary care, I will say, is a very important, but it's a very big, small department in these rural areas. Challenges, as I mentioned before, extended schedules could be some ways to improve the access, online access as well. However, we have an aging population or newcomers population who have barriers accessing those online medical cares because they're not familiar with, or they don't have the language, or they don't know the technology to get access. And also self-awareness. We cannot only expect the system be better because like being just looking at the system from my position. Also, we need to be have self-awareness. What are the improvement, or what my healthcare provider needs to know about me, and in that order, provide me with the best care that I need. Like cultural, what are the accommodations we can provide for somebody? Nobody's gonna know if I don't mention that, but is provide that safety environment for the patients. That way they feel comfortable, and it's going to be a psychological safety.
Okay, I'm going to touch a little bit more on the mental health aspect of it. I do agree with everything that's been said when we talk about the geographic location of some of our indigenous communities. They are, if you look at a community like Fort Chip, they're not accessible. They can't just, jump in a car and drive to the hospital or get mental health supports here. And a lot of the organizations that do go into community are on scheduled time. So you'll have, some organizations like CMHA, they're there for an entire week, but they're there for a week in a month. So, when people are facing mental health issues and challenges, they're not necessarily going to be on somebody else's schedule. So you find challenges like that. And then when you go south of Fort McMurray, you look into some of the rural communities there, some of those drives can be an hour, 15, an hour and a half away from town, right? So when they're needing mental health support, they're not going to have the, people that are needing to be there to help them. So I found often when I was working with clients, I would be trying to come up with a safety circle for them so that they would have people that they could reach out to in those crisis moments. And I think that's the other part that we don't think about when it comes to mental health is often mental health is crisis. These are crisis moments when we're dealing with clients, and sometimes when you're in the thick of the things, it's almost though your mind is working against yourself. So you face things like pride and not wanting to maybe, reach out to or access what is available. And so I find that's one of the major challenges that we're facing, as well as, when it comes to anything specialty related, we don't have access to a lot of that work, right? I was having a conversation with Amaka earlier, we were talking about even psychiatrists. When it comes to mental health, we do have a lot of counselors, which is incredible in this community, but when it comes to psychiatrists, we don't have access to that as well. So I find when we're facing, stigma, we talk about stigma on even diagnosis of some of our mental health challenges, we don't have access to necessarily really, professional people that are going to be able to help us with that. And when we do, in an indigenous community, we're facing a lot of the stigma of, you're fine. When we go into further conversations, I'll touch a little bit on generational trauma, but being raised by residential school survivors, I grew up in a home very accustomed to just make everything look good on the outside and on the inside, whether you're not okay or not, everything is fine. You're fine. So I think that was just some of the major challenges.
Okay, I probably to add on to that because I also want to touch on mental health issues. There's also issues to consider like cultural backgrounds. Because where I am from, the way we grieve is different from maybe the way other cultures do. In some of the cultures or in my culture, I would jump around, throw around, cry, scream and all that. Whereas in other cultures, maybe when I'm here, I have to be more conservative and I can't express myself in a way that I'm really used to. So it's understanding how each culture or how different people perceive different situations that can help in making people more comfortable in their skin and to reduce more mental health issues. There's also like how the society perceives it. I'll also take it back to where I'm from. Before, when somebody had mental health issues, it was either a shame to the family, you were not even allowed to, it could be felt, it could be transmitted, either through touching or talking, so these people you could not talk to them. So I like the idea that we are here discussing these issues because we find like in some other cultures these issues are no-go in them, we cannot discuss them. So it is okay for people to come back and talk and say, you know what, when somebody is in this situation, it's probably either it's biological or it could be psychological or it could be this, and this thing has nothing to do with what this person has done. And if somebody is expressing themselves in stressful situations and after trauma, let it be. So maybe some of the things that could be done in mental health institutions, try to consider including like cultural remedies that that were used by those people in helping them overcome such situations.
Well, thank you to the panelists. You guys gave a lot of insight on some of the barriers that some of us in the audience may not be aware of, and touched on some things that we might personally be connected to as well. So thank you for that. Before we move on to the next question, does the audience have any questions pertaining to this? If not, we will move on to the next question, so I'll have Olivia come ask.
Okay, so our next discussion is on, in your opinion, what role does cultural sensitivity play in promoting health equity, and how can healthcare providers improve in Sera, especially pertaining to mental health? Anybody can start.
I actually just had a conversation about this the other day. One of the questions I was asked me was, if you were dealing with a client or a patient, how would you implement cultural into it from an Indigenous perspective? And my first response was, don't always assume that an Indigenous person has played a part in their cultural upbringing. We speak about Indigenous people, we talk a lot about residential schools, the 60s school. Very often Indigenous people have had culture taken away from them. And I think that cultural sensitivity part is not always just assuming that you can implement it right away when it comes to a mental health perspective, but maybe being sensitive and asking questions to inquire whether that Indigenous person has had culture in their life. And then when you do have that, we're really big on storytelling, so I think asking questions and being sensitive to it. But also being able to put your pride aside if you had a plan on how you wanted to implement something that it didn't work out. And I think that's a really important piece, is being adaptable to it. I think also always taking into consideration, like I said, generational trauma has played a factor into a lot of things. I'm really big on looking at everything from a biopsychosocial model. And I know if anybody who's a social work background, you know. So biopsychosocial has 3 aspects. So the biological aspects, which include genetics, physical health, and organ system function. So we know that Indigenous people we grew up in different ways, we've eaten different foods, our environment has affected us as well as biological. So psychosocial, the psychological are including thoughts, emotions, behaviors, such as psychological distress, fear, and coping methods. So this is when we want to bring in the aspects of the 60s food, residential schools, generational trauma, and then the social part, which includes environment, cultural factors such as work issues, family circumstances, and benefits. So one of the major things from an Indigenous perspective is the way our communities are ran now is not the way our communities were ran many years ago. So being very cultural sensitive is important. I've sat in rural sharing circles where I'm the only Indigenous person out of a bunch of organizations that are coming to support a rural community. And one of the things that I've had to say time and time again is, as much as Western education is very important, when it comes to working in with rural and Indigenous communities and people, I almost want to say, take your Western education and kind of put it aside. Because often we learn, and I'm going to call them systems, often we learn systems of, let's say, 1 through 10, this is how we're going to do it. We're going to meet the person, we're going to ask them questions, we're going to fill out the form, we're going to gather the information. And in reality, that's not how the system is going to work. You kind of have to take the system and kind of revamp it. You have to be adaptable because, again, when it comes to mental health, you're often facing crisis of mental health. So being able to meet the person where they're at, take into the biopsychosocial model, take in those things into consideration, but also just be a lending ear to listen. Don't always assume that we need to fix something, we need to fix it where it's at. So those are my, when it comes to cultural sensitivity.
Thank you, very inspiring.
I could add to that. I totally agree with what Angela just said because I mean, when you look at people from diverse communities, one thing that comes to mind is the ability to be able to be present for them and sit and listen to them. Right? So actively listening to somebody's views, somebody's beliefs can actually help you to be able to see things from the way they do things. Like for example, when she was sharing, like, in some cultures, if you have a problem, maybe there's a death in the family, you scream, you shout, your neighbors come running and they're asking you questions, they're asking, hey, what's the problem? How do we help? How do you be of support here? But, coming to an environment where everybody just locked up like fucking boys, sometimes we don't even know our neighbors, I'm very sure. Or you get to see them once in a while, hi neighbor, and that's it. So people are lost in their own world most of the time, especially when it comes to things like winter. It gets dark in the morning, you're going to work, it's dark, you're coming back, it's dark. It's at various schedules and stuff like that. It can be very, very challenging. So being culturally aware means that if somebody comes in, for example, I have a couple of people who work with doctors, and when it's a doctor and it's a male doctor, culturally they're not wanting to see a male doctor, they want a female doctor. So you have to be aware of that. You have to be sensitive to know that, look, this is this person's culture, and it's their right to be heard. So I guess what I'm saying in all is, like, I do agree with Angela and everybody, but actively listening and just being there to know and see also makes a lot of difference. And then providers should also collaborate with community leaders and integrate cultural appropriate practices into their services, ensuring that care aligns with a person's values and belief, right? Get popular people to do some adverts. You see Nike taking up the basketballers. If somebody is playing in a particular, I talk about basketball a lot because my kids play basketball. So if you see the typical Nike or whatever adverts, Louis Vuitton advert, you see like a very popular, basketball player. They pick them and they use them as a model. So if we can get like leaders in our community also advertising for mental health and saying, hey, this is the right way to go. We need to do this in the appropriate way. It makes a lot of difference. So that's what I wanted to add to that.
I would like to add, like, cross-cultural awareness really make us open and do unfamiliar attitudes, practices, behavior. But one more time, we have to be careful about putting people in stereotypes as well, because it's easy to jump into those situations. You mentioned something before, like not because somebody have a background, he has living in those situations, right? Somebody like, and maybe some of you can agree, like you are part of a background from some countries, but you grew up in a different country. Then your culture and your parents have different values, different views, and we have to be very open and sensitive to listen, as Amaka mentioned, and observe as well, and not just assume what are the values of the patients, right, in general. I have been seeing in my community is basically long hair, how these attitudes have been changing. We have in the last 2 years more awareness, more education workshops, how to approach different communities, especially indigenous community. I think this group especially is very strong, has been very active in changing the way the health system look at them, treat at them, and we start appreciating also more like their values, how is the right approach, how they feel confident, and how make a safety environment for everybody in general. We invite, as you are part of different communities as well, to be part active and let us know as a professional healthcare providers, what do you want? What do you prefer? If you need more time, or like a female doctor, or an interpreter with being with you at the appointments, it's the time to talk about that, because it's right, and then the system can provide. We have in this rural community amazing resources, especially interpreters who can help people during their appointments as well. Then it's very important to participate, engage, and fostering respect for to increase the understanding of the different cultures.
Thank you. Any other thoughts?
I'm gonna say, I must say, I like that Canada has this, is open and it's accommodative of people's different beliefs. To a certain extent, you get in, you look for assistance, you'll be asked, what is your belief system? Are you a Christian? Do you believe in the superpower, the higher power, sorry, or what is it that you believe in? And there's no judgment there. Whatever it is that you believe in, the worker or whoever will be helping you, leading you to getting to know better about yourself, so that they understand how best to work with you. What I think I'm seeing is many workers have empathy for their clients. I'm not sure if they may not be, because that is what we need for especially mental health issues, or for people who are facing physical challenges. One mental health issue from my perspective, or from my background, is, like I had just shared, is something that was shunned upon. You would not freely express yourself, that all the family would have to hide that they have an issue that is going on with mental health. So here I see there's a question that I usually ask when I'm at work that I still find uncomfortable asking now. Do you have issues with substance abuse? And then I know if it was back home, you can't ask anybody that question. You will be in trouble, especially if you're young and you're asking an elderly person. So I want to applaud that part about this country, that yes, there is that, which is helping alleviate some of the challenges that I know in some other parts of the world, there would be a lot of stress to people's lives.
Sorry, I wanted to add something else. I don't know if you stressed or tread on the fact that education is also key for providers, because, I mean, again, if the providers are not well educated in that field, they're just going to give whatever they have from right inside of themselves. like as a social worker, like we rightly say we unlearn to learn new ways of doing things, right? But sometimes it's pretty much hard to unlearn. So it's a conscious thing that we need to consciously be aware of, that each time we're faced with somebody, like she rightly said, there are a couple of things that come up for me when I'm addressing a client, when a client comes to me, but I just have to take the client at wherever they are and deal with that, right? You're not going to tell a client because they have this religion, I don't want to talk to you. No, you don't have the right to do that. So education is very, very key.
Thank you so much, panelists, for insightful thoughts. I learned a lot listening to you. And does the audience have anything else to ask? Yes.
I have a comment. All of this talking about different cultures, I had to get used to a different culture growing up. I'm Dene. My dad is an Acadian. He's French. Well, he passed away, so he was Acadian. His family never accepted us. So I never tell people, oh, I'm a proud Acadian, because the family never accepted us. So all of this talk about culture, growing up Dene, raised French Canadian, coming into English school, I had a rough time growing up. I mean, I was born Dene, I was raised French, and then at grade 3 I had to go into English school. So Dene, French, English, that's 3 languages. And even to learn about how to speak and learn an English language after being raised French was so confusing for me. And what a lot of people don't realize, like all these outlying communities, they don't have doctors. The only place that has nurses is Port Chip. Janvier, nobody else has, like, well, Port Chip has nurses that live there. But to have an actual doctor that lives in community, you don't have it. And a lot of our people suffer from chronic illness, cancer, kidney problems, TB. There's a lot of things. So when we come to access services, number one, there's always the issue of language. There's one community that has preserved their language, and good for them. But when they present themselves here and they don't speak English the way that people would expect them to, they're looked down on. And even my partner doesn't read or write English, and he had cancer. He has cancer. So when he first found out he had cancer, oh my goodness, you know, all these words about this and that. And we went to see a cancer navigator, and she gave him 3 pamphlets in English, and I was like, he doesn't read. Well, you interpret it for him. No. You're the navigator. You interpret it to him in Cree. Well, she couldn't. So then our people, we suffer a lot of very poor health because number one, we don't understand. We're thinking in a different language, and when you're raised in a different language, you think in that language. So a lot of our struggles, when we get angry, no wonder. If we present ourselves to the hospital, number one with an addiction, and number 2 with a mental illness, guess where we end up? On the psych units. And that's sometimes not the best place for us. So incorporating cultural, there's no excuse for people not to know that there's different cultures here. Not just our culture, cultures from all over the world are here. And that people have to understand that we're not all from one type of culture. Even though we're indigenous, there's all kinds of indigenous people. And you don't insult people when they present themselves with issues like, I don't understand what you're saying. You know, you don't dummy it, you know, make it, like, dummy it down. I've heard that term many times. Well, maybe we should dummy it down so you can understand. Like, what are we? And So I spent my whole entire life in health and addiction and treatment. And a lot of what I've seen about healthcare providers doesn't sit well with me. I even took nursing. That did not sit well with me. Because number one, I believe in life. Number two, when your life is over, it's time for you to leave. And so I had this big struggle all my life with a lot of things about health and about the way our people are treated. And sometimes people think that we're difficult. Well, what do you expect? You know, and I've had to change my way of thinking because I help with the public school. And we have all kinds of kids from all different cultures. I do land-based learning with kids. First thing we learned was there's kids in the school system that don't speak English. And I was like, oh my goodness, how are we gonna do this? But a lot of kids adapt. And the other thing is in food choices about pork. There's a lot of things that I never knew about pork. Well, guess what? I quit eating pork now. And so a lot of the times when we do things, we don't put pork product in what we're feeding the kids, or else they have their own type of food. So I've had to adapt. So I think everybody has to adapt too, because there's a lot of misconceptions about our people. And for myself to live in a culture of Fort McMurray where there's a lot of different cultures, and I've been here since '71 on and off, and I've seen a lot of changes. And to see our people suffering from health problems, and it really bothers me because we're entitled to health as a treaty right, and that's what a lot of people don't realize. Health is a treaty right, and it doesn't have anything to do with AHS. Health is one of our rights, and for everybody in Canada and across the world, health should be a right that everybody has access to, but a lot of us don't have that access. And I'm really grateful to see different cultures, but to see young people. Young people are the ones that open-minded, you know? And even with little kids, when I work in the schools, these little kids are so open to learning about our culture. So thank you.
Thank you. I want to thank you, Lorraine, for speaking up, especially sharing that, especially with on language. I'm lucky enough that I've had Lorraine's support. I've called upon her as an elder when I work with clients, and I think it's important to utilize people like Lorraine that are elders in the community when you're working with Indigenous clients and you face things, challenges like cultural beliefs, systems, or language to access people like Lorraine. Lorraine is actually the reason why I went into social work. She probably doesn't fully know that, but it was many conversations of having with her that really pushed myself to go into school and become a social worker. But I do really thank you for adding all the information that you did and speaking on behalf of Indigenous people. But please, when you are in work and when you are working with clients, when you do come and face the challenge of Indigenous people, call on people like Lorraine and elders of the communities where the people come from.
Thank you so much for all your insight. It was really inspiring to listen to all of you. Now I'll be inviting Nishka to discuss some thoughts on our next topic.
So now we'll discuss some thoughts on health challenges that are faced by youth before we go into some more questions. For youth, one big challenge is the impact of social media. While it may help us stay connected, it can often create unrealistic expectations that harm self-esteem. By having open conversations and teaching healthy ways to use social media, we may help young people feel more confident and balanced. Another challenge is navigating puberty, which comes with so many changes, both physical and emotional. It can be overwhelming, but providing education and support can make a big difference in helping youth feel informed and less alone. Now I'll pass it over to Shrishti to talk a little bit more.
I wanted to discuss the topic of mental health and mental well-being. Although mental health is now widely talked about, in some communities it's still a touchy subject. When it comes to sustaining your mental health, asking for help when you're struggling is key to ensuring a good quality of life. But in a community where mental health isn't talked about, it's important to know who to go to without feeling judged. For students, mental health counselors are available in school, and for adults, there are multiple psychologists and therapists throughout the city. There are also a numerous number of helplines to connect with a specialist instantly. Mental health affects your quality of life and ability to live your life to the fullest. Surrounding yourself with people who love and support you is another way of uplifting yourself through difficult times, and support you in another way of uplifting yourself through difficult times. I'm sorry, I repeated that. With speaking to a professional. Indulging in hobbies that bring happiness and spending more time in nature are also known proven ways to uplift your spirits.
So we'll now go into the next question. So what steps can schools take to better address mental health concerns like stress and social media impact among students? So I'll pass it over to the panelists.
I wouldn't mind starting. So I think it is very important that teachers also have mental health as their first and foremost when they're moving forward and dealing with teenagers who are going through puberty, who are going through the social pressures of what is going on in society, so that they have a better education so that they can help out with the students. I'll give you an example. In my son's class a couple of years ago, the teacher was not in a position where she was emotionally prepared for a lot of young children, and she had what she called a shame jar. And in the shame jar, when a child was caught playing with something, they would have to walk to the front of the classroom while the rest of the children yelled, shame, 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 put it in the jar, and walk back. This was in grade 4. So, needless to say, I was not very impressed. However, when I brought it to the attention, she defended it. And that was very interesting. Of course, it was then taken away, but really, she could not see what the problem was. She did not understand that these children were shaming one another, and they were okay to be on the side that was shaming, but they didn't want to be on the other side, and they didn't understand the difference because the space that they were supposed to be in was safe. And so something along these kinds of lines, if this comes with your subject might be social studies, but really there should be a huge element of the age and behavior and things that will be taking place by the grade that you choose to teach. Because you must be able to handle it mentally on your own, but also be able to get to where a child's level is at. That's all I have to say.
I want to add to that by saying that providing accessible support services such as online counseling and on-site counseling, and you talked about the counselors, the school counselors that they have on site. That can also become a problem because I know a couple of schools have like maybe one counselor and then lots of students around. So giving the teachers education will be like a first call for me, right? The teachers have to be well educated concerning mental health and how looking at things like that will work out. Because I mean, again, if we're living in a society like the youths have coinage, they have slogans, they have a lot of things. A couple of days ago, my daughter wrote something and I was like, wow, what does this mean? I don't know, but they know, right? So you have to be correct, to be able to teach them things about what's going on in their world. And also creating supporting environment through peer support groups, anti-bullying programs, and teaching digital literacy also helps students to navigate social media responsibly. Like another thing I also wanted to draw attention was caregivers, right? They should be role models. If you're not a role model, like how do you expect your child to drop the phone when you're 24 on it, looking at one thing or the other, Twitter or TED Talk, you're always posting something, and your kids are seeing that once you post, everybody shares and it's on the media. So just being aware of that, like, to portray that is something to be aware of. And then also making sure that there's always relevant and up-to-date resources for the students to be able to assess whatever they need to know about. That's what I'd like to add to that.
I would also like to add, maybe school systems could incorporate mental health issues into the curriculum so that we know that kids will have access to mental health. So besides my colleagues here have already touched that, like building positive school cultures and making sure that the school is safe and supportive, because lots of bullying happens in schools. So that's a fact. So how do we mitigate that? How do we make sure that children know how to behave with each other, and if they are being bullied? Because I know my son was bullied. It took us a very long time for him to stand up and tell us that this is what is going on, because of the fear of what will happen to him if he reported and people were taken to task. So it happens a lot. And we also, as parents, in as much as we try our best to be close and have open discussions with our kids, there's also that culture at school that is being imposed that you don't tell me, you'll be a crybaby or whatnot, you'll be labeled. So yeah, so they need to relook at like how the school system works and probably just put it in the curriculum.
I am not a mental health worker, I am not a teacher, I'm a parent, but I recognize it's a very difficult task for teachers these days, especially because the teachers have to deal with the system where they work with the students, but also with the parents. And we as parents have also responsibilities in this matter of social media generating stress, anxiety between the students, right? Recently, Australia comes with this banning a new program of TikTok and some other platforms. Let's see what happened there, but be mindful is very complicated, it's very challenging even for ourselves. Then we know all these systems that can be put in place, but really it's through education and try to be in contact with our feelings. Sometimes we go to distract ourselves in our phones just because to distract from the real facts. Then having mindful conversations at home, taking back, having dinner together or moments of coffee. Sometimes it's not only, or today we're talking about youth, but we have to be mindful in ourselves, like or sometimes going for coffee together. Let's have a coffee. It's also important. It's an act. It's a stepping up for our mental health. Then it's very challenging. That's the only thing I have to add.
Thank you. Does anyone else want to add to that? Okay. Thank you so much. That was really insightful, especially for us as students who are currently in the school system. Before we continue, does anyone have any questions from the audience? No?
I actually have a question.
Oh, yeah. Thank you.
How do you guys feel about the rules of no cell phones?
I would say at first it was definitely a little hard to get used to because I feel like, as a grade 12, like we always kind of have our phones near us, and although I don't really use it in class, but just like near you, I guess. But right now I feel like I'm kind of used to it, and in some ways it teaches me to not always be on my phone, and I'm more aware of my surroundings and stuff. But I would say that there might be some benefits and pros and cons to it for different students. So,
are you noticing a difference when it comes to the stability of people's mental health throughout the day when they don't have access to social media and phones, and communication has to be done by mouth and not over? Do you notice a difference in the classrooms?
Yeah, I'd say it's definitely like, I feel like everyone's a lot more attentive in class and we have more conversations because everyone's focused on the lesson and a lot of conversations are happening. So yeah, I would say, I guess in those ways it definitely helps us as students. But yeah, thank you so much. I'll pass it to Shristi to the next speaker.
Okay, next question. How can we encourage open discussions about mental health in communities and cultures where it's still considered taboo?
So I think kind of what I touched on when it comes to being culturally sensitive, when it comes to Indigenous communities is important. I think the way that our communities were originally ran, the roles that, let's say, elders played has changed tremendously. We have a lot of situations now where elders that were maybe in mentoring positions with their grandchildren are now raising their grandchildren. And we're seeing that because of situations like mental health, physical health, as well as addictions. So I think that, being able to make things relatable to people is very important. I know when I did spend a little bit of time in Fort McKay, one of the things that we would try to do is when speaking to elders is trying to move past the taboo, but trying to give them information that was relatable to their situation. So if they were raising a grandchild, I'd have the conversations with them with like, are you noticing any things with your grandchildren? Are you noticing that there's anger or anxiety, things like that, and then making it relatable. I felt like the barriers went down, the walls went down, when I can relate it to something that was taking place in real life. And I think that's what most of us, right? When something is relatable to us, then we're more attentive, we're more open to the information, and we're more open to maybe putting some of those tools into action. So I think that that's one of the important things, is trying to make it relatable, being culturally sensitive, but also understanding that in many cultures, when I was in school for social work, when we would talk about, even with my victim service training, we would talk a lot about like how to address other people's cultures. Maybe understanding that I'm not going to make direct eye contact with, females from different cultures because it's the male that I'm supposed to be addressing, and situations like that. So I think like just always maybe checking yourself in, being aware of your biases, absolutely, as well as your body language, as well as your tone, as well as reading a room. I think often when you're in a social work field, you're always reading the room, you're reading a person. I'm looking at, that you're shaking your foot right now. So little things like that, right? Or I'm looking at your body language, or that you're making eye contact with me. And I think just being aware of those things as well, and making it always very relatable.
I also think, again, going back to what Angela just said, education is key to everything. Get people educated, hold seminars, and also the fact that if you begin to see mental health as a health issue instead of a taboo, it can make a lot of difference. Because people come up with, I have high blood pressure, and everybody says, oh yeah, you have high blood pressure. Let's get the person straight to the image. Let's do this. Let's do CPR. But when you say, oh, I have ADHD, everybody's looking at you, okay, we need to watch you right now. We need to know where it's coming from. Or you say, oh, I've got this problem about dreaming and hearing voices. Everybody, okay, let's take a break from you, right? So if we begin to see this as something that we can actually share and be bold enough to talk about it in the communities and schools where we are at, it makes a lot of difference. I've seen kids who have been saved just because they could talk to people about their mental health issue, and it can turn out to be suicidal cases, right? So if we can do things like that, that will go a long way in helping us thrive.
Thank you.
I'll just echo a little bit more on what Angela said there. Is speaking the currency of the culture and what is important, because everybody is going to have something different. So when we look at our kids, if we say, well, I'm going to take this away, and they say, I don't care, you're not speaking in their currency. Yeah. So figuring out what a person's currency is, so that, and what they're looking for as the long-term result, will then make it easier to, if you're talking to, say, a parent where they don't want to talk about their child's mental health, if we talk about things like, where would you like to see your son or daughter? Do you want to see them as a teacher? Do you want to see them as an educator, as a doctor? You know, these are the things then working backwards to, this is what we need to do in order to get into that space.
Thank you. Tanya and Mia, would you like to come up?
Now we will present some thoughts on health challenges faced by adults in our community, followed by questions pertaining to adults. So everyone has equal rights to access healthcare and the resources they need for their bodies. Healthcare can be seen in a variety of forms, whether that is a hospital for emergencies, walk-in clinics, routine checkups, or overall wellness. However, improvements to healthcare access can always be made. And in order to address health equity, we need to fight against factors such as discrimination by ensuring healthcare providers have received proper bias training. Another issue that needs to be addressed from its root cause is the difficulty of low-income individuals to maintain a healthy lifestyle due to a lack of access to proper diet, physical activity, or resources that they may need. To address financial stress, it is important to have someone you can talk to. This can be a trusted relative or friend or a professional in the community. There are many organizations in our community that can support individuals through their financial stress. So this leads into our next question. How can our community ensure that low-income individuals have equal access to a healthy lifestyle to obtain physical health, including proper nutrition and exercise opportunities? So passing on to the panelists, whoever would like to start.
I'll say that's a very tough question because most times the whole place is influenced by the powers that be, right? And if people are not well paid in the community where people are not well paid, it trickles down, you know, and the effect is that people don't get to participate in things to do with their mental health and their physical health because they don't have income. So initiatives could be put out there where subsidize things like gym, going to see a mental health therapist and stuff like that. Because I mean, again, like Angela said, I think it was Angela that said that like paying that huge amount of money to go visit somebody could be like very not interesting when you don't have the money. So if people are aware, like some people are not aware, like even with their, you know, your healthcare card, you get some benefits. You only have to go to your doctor and let them know that maybe you have something ongoing for physiotherapy and all those kind of stuff, and you can like provide that write-off for you to go assess your benefits. And also with your healthcare card, I think you have some privileges of being able to assess some of those things if you're aware of it. So it's just the education you put out there that makes the difference. And there's something about skill, right? I think some therapy or some counseling sections do a gradual skill stuff. So if you are low income, you can also bring that up for them. When you go visit like your healthcare provider, let them know that this is your income and there's always that preference that takes place there.
Kind of adding on to what Amaka was saying, we were having a conversation earlier about accessibility, and this is accessibility from the mental health. I know this is, you're talking about this, but a lot of the organizations in town don't have the NIHB benefits. So that's the non-insured health benefits where people from Indigenous rural communities can go to an agency and maybe see a counselor, and then it's directly billed to the government. So I sit on the board for some other solutions. At this time, we currently don't have that, but that's a conversation we have continuously around the board would table is how can we meet the criteria in order to be able to provide that service to the community, which then Indigenous people would, be accessible to them. Because when you're talking about low-income families, and you're talking about accessing resources like mental health, it's the average person can't pay $180+ to see a counselor, right? So that's coming out of your pocket if where you're working is part-time, you're not getting, full benefits, which is another thing that low-income families face on a regular basis. And so when you do talk about Alberta Health, the accessibility to the organizations is very small. Amaka, you work up in Kimberley. You're busy all the time. It's difficult to get into those Alberta Health services for counseling. So I think that we can encourage a lot of organizations to be able to meet the criteria for something like NIHB, then we would have more access to it.
And another thing too is, like, people don't know, but as long as you have your healthcare card, you can walk into those counseling services. You get at least 12 sections that are free. 12 sections. So you go in, you assess the working team, and after speaking to the working team, they would redirect you to a therapist. So you get to see a mental health therapist, and you get 12 sections that are very free. Just most of the time, people don't take that advantage. So just being aware of that also helps to be able to know that you can actually assess that. So for everyone that is here, I would assume that you guys have been in Alberta for how many years? 1, 2, 3 years? Like, that means you have access to that. So just go in and let them know. And even culturally, because I know that I used to go out to, I used to work in Kai before, and aside from Makai, I go to Jambe, Cochrane, and Foster Spring. Like, I go there like on a weekly basis, up till around like last year when I stopped going out. So for those that are also in those areas, just like, the only thing is that we come at certain times. That just the only hindrance to those care. But you can actually access those centers from wherever you are. You can ask for Zoom if you don't want to come in. Ask for Zoom, right? So that's the advantage of the technology that we have placed in front of us. So, yeah.
One of the things that Mikisu is doing right now through their family support department is accessing some of the organizations and having like bread programs or school lunch programs where you can sign up if you're a Mikisu member, you can access getting lunch for your child for that week, or you can pick up bread that will help if you're having, when it comes to nutrition. I think the other thing that we lack in the community is transportation accessibility. When you're a low-income family, if you can get, a gym membership or a deal at Mac Island, let's say, it's the accessibility of transportation to get there. I think that's one of the biggest things we face in communities.
I want to talk in that matter about exercise opportunities, physical health. In this matter, I want to touch about recreation in our communities. That helps a lot with something that you were a little bit different, the questions. You mentioned the word happiness or happy, and then there's resources in this, but in this community to the activities that people can access, they're free, but they don't know they are available, right? Because when you visit certain places, you can read what is available for you, but there's a lot, especially newcomers, they don't visit some places, then there's no way they're gonna know they can practice cross-country ski for free if they don't know where to look at. You don't know where to look at those free activities. Then really it's a challenge for them, and that affects their exercise level. If they don't have the proper nutrition, just sitting and talking to community members, they can know what is available as physical activities, where to get the equipment, how to get help for some organizations to be part of these activities, because our recreation is so labeled. Everybody wants to have to sign for activities. Oh, I sign for basketball or hockey or this and that. There's other activities that people can do but they don't know they are available. Sometimes and they don't need to travel like the long distance, like Beechwood Trail. Maybe if they live in Fleetwood, go for a walk, because it's not part of so many cultures. Just walking is you walk to go some places. Like you walk for work, you walk for an appointment, but you don't walk for fun. That is a new concept in physical exercise. That is for some cultures. And those are activities who are available. People can exercise. There's a bunch of people who volunteer their time to coach exercise in like cross country. I always mention that because it's a wonderful thing that we have in town, and it's available and free for people. Then recreation is part of your mental health. Sometimes if we are low income, when I was a newcomer, everything for me was excessively expensive. Just thinking about like going for cross country, oh my God, I have to pay for those equipment. What I'm gonna do with those? I have kids. Then next summer, the equipment is not gonna be good for them. In my country, we don't have that. You buy your equipment, and it's not passed, because you don't have most people to pass those equipment. But there's a possibility here. There's a bunch of groups, even in social media, when the parents collaborate between them and pass equipment. But if you don't know that exists as a newcomer, for example, there's no way you can use it. And that, as a newcomer, most newcomers are low income, and that is a proper way to exercise, just walking or having support groups to include these new concepts in their life.
Also, subsidy. I'm sure a lot of you play sports or know somebody who plays sports. Sports in this community is very expensive. Very expensive. I'm a female coach for girls hockey, and the amount we pay to minor hockey on top of, because we're a competitive team when we travel, there's a lot of families in the community who cannot afford to join that association. And I think subsidy would play a huge factor in allowing people, and we know that once that physical health part is in there, it's also going to contribute to the success of their mental health.
I'd like to touch on that a little bit, because there is a lot of not-for-profit organizations within our community. So the Multicultural Association, for one, would then link to something like Wood Buffalo Sport Connection, which would then link to something like Kids Sport. And so the challenge becomes, where do you find it? That is the biggest challenge. But these organizations are out there, and there is some part that is our responsibility, because when we moved to Fort McMurray, we didn't know anybody, we didn't have any friends, we didn't know anyone. Now, we did speak the language, so that was definitely more different. We were from Canada, that was definitely different. But we had to go out and find the different places where we could create new friends, create habits. And it's funny that you mentioned cross-country skiing, because I did that for free. Yeah. Because I found an organization where they'll lend you the skis, you can go out there, and I am not good at it. However, it was a really great, it was a very challenging experience. But it was really great. And it's just a matter of really just taking the first step to find an organization that can take you to the next one. Because when all of you move to new places, whether you go to school in Calgary, whether you stay in Keano, whether you go to Ontario, you're going to have to figure out who and what is around you and what is available for you, and that's something that you will need to do on your own.
Yeah, well, thank you for that. And like you said, that connects to us too. A lot of us are in grade 12. We're considering where we want to go for education next, what we're planning on doing. And if that takes us outside of Fort McMurray, we're going to have to look for organizations like the Multicultural Association in those new communities too. So thank you for sharing that, and I'll pass it on to Naya.
So I'm going to be exploring the topics of financial stress and work-life balance. So did you know that 68% of employees with an imbalance in work-life experience poor employee morale, essentially meaning a lack of motivation to work? So in this current day and age, it's vital for one to balance their work and personal life, as it's necessary for maintaining their well-being. By having a good work-life balance, you're improving your mental health, and you're maintaining strong relationships with others, ultimately boosting your productivity and personal growth.
So ways to balance your work life include setting clear boundaries with your work. So this can include like setting a clear schedule and avoiding the taking work calls outside of your set time. Because I know that a lot of people like have their work life kind of penetrate into their personal life. And then another way to improve your work-life balance is to practice time management and taking small breaks. So you can go grab a drink or like go grab a cup of coffee with your friends. It's important to learn how to say no and prevent your work life from infiltrating into your personal life. After all, work-life balance is not just about increasing productivity, but taking the time to improve all aspects of your life. So my question for the panelists are, what practical strategies can employers and employees adopt to achieve a better work-life balance while addressing financial stress in order to ensure the right to mental and physical health is met?
That's a very heavy question, all in one. Very heavy. There is definitely a huge amount of responsibility that comes from the businesses. A lot of them will have some sort of insurance policy that they'll have in place where they will have, whether it's different seminars or free access to mental health programs, classes, things like that. And then there's the fact of how much workload gets put on you. And there's one thing that I will say that I do really respect about this younger generation is that when you're done, you like that phone doesn't get answered. And it's interesting because my age bracket says it's rude and it's inconsiderate and you have bad work ethic. And truly, it kind of feels that way because we never had any of those boundaries. We didn't, you know, if you called, we had to get up and go. You had to walk to work or take the bus or whichever it is. So it's interesting to navigate through. As somebody that works with the public, and if I didn't set my own time blocking, I would work every day of the week. And I can't do that because I do want to be present for my children. So I make a rule that my workday does end at 5, but I end it for sure at 6. I don't answer calls, I don't get back to anybody, I don't slide emails through, anything along those lines until the next morning, but I had to make that decision for myself because I wanted to make sure that I was present for my kids. And what I found is that if I wasn't following those guidelines I'd set for myself, I was frustrated with my children, and that wasn't their fault. It was me overstepping on my own boundaries. So that's my personal feelings on it.
I would say look for what you enjoy doing as an additional thing to that. Set boundaries and look for what you enjoy doing as a person when you are out of work. Because I sing, I love going for my rehearsals. I'm sure what was it? You had called me yesterday and you must have had a lot of singing and stuff like that. That's my own time. That's my me time. So look for something that would give you joy when you're out of work. And I think that's one of the things that needs to be established to be able to create a better work-life balance. Also, maybe adding to that would be like, look for a group of people that enjoy the same thing as yourself. It could be like doing arts and crafts and stuff like that. There used to be like Zumba when the old YMCA was there. It was a good time to like go and cruise and do whatever dancing you wanted to do. That's been taken away from us because, I mean, we don't have the Y anymore and the people doing Zumba have all moved away. But that was something that was interesting. You know, so look for things that give you joy and cultivate on that and run with it.
From an employee perspective, I think when you're interviewing for a job, ask some things like, is there policies put in place? Is there structure with your physicians? You know, if you're going to be on call, is it structured on call? Are you expected to be accessible 24/7, or is there a system where you get the on-call phone once a month? I think it's important as well to advocate for yourself and to take that power in your own hands as well, especially when you're, as some of you guys will be graduating and looking for jobs or going to post-secondary, ask those questions be your own advocate. I'm actually sitting here right now. I keep checking my phone because I'm actually on call. I'm hoping that I can make through this without getting a phone call. But yeah, I think that is also important as well to advocate for yourself.
I just want to add, like, when we start choosing our careers as well, you have to, I know it's very demanding what I'm asking you to do probably, but you have to visualize yourself in the future. Like, what is the kind of life you want? And what are the sacrifices you are aware that you have to do? That you can have it all, maybe, you have, but not at the same level. You cannot be 100% in everything. Sometimes you have to sacrifice, like sometimes this is important in this moment, and then try to find a balance. Maybe some people can differ of that opinion, but that's my opinion. Like, you have to set up your priorities, your boundaries, but also your expectations. Your expectations can change during the time because you have to adjust to life. And if you are clear in that, as you go for an you're choosing your career, you are choosing a job, those are the things you're going to keep in mind. Okay, this is going to be a sacrifice. I hear a lot when people are new in this town, oh, I'm going to stay for 2 years or 5 years, and then it passed 15 years and they're still here. Because at the beginning, it's just saving money. Like, I come here to make money, but making money make you spend money. Then you finish not saving on those 2 years what you expect, because oh, now I have money to travel. Let's go and travel, and then you go in the cruise. 2 years after, you don't have still the money, and then you stay. Then life is just adjusting from that, and same with jobs. And then that was the only thing I wanted to add.
Okay, and then I would like to add that, with financial literacy, we're not taught it at school, nor can your employer force you to take a financial literacy course. It's something that unfortunately you have to do it, take it upon yourself to equip yourself with financial literacy, have set yourself financial goals, attend or read financial stuff. So it's really tricky to say how much can your employer assist in terms of your knowledge or your being able to navigate your finances so that you don't end up being frustrated because of when you're broke or you don't have enough money to make ends meet even though you're working. So some of these things will probably currently be upon yourself to take on. And then when you're working, mostly works are stressful, but there's also this issue that has been highlighted that self-care is also very important. Try to find something that you love. I know it's tricky, some of us are everywhere and everywhere at the time, but try to find something that you like. Also building networks, find people that you are like-minded, you have like-minded, you love the same things. If it's hiking, you don't need a lot, it's probably just getting a good pizza and something to eat, and just walking around and seeing what might be really beautiful in summer. There's so many places that you can go to in person and all that. So those are some of the things that I think I try to do, and just to keep stress on me.
Yeah, well, thank you for that. Doctor.
I don't know if my mic's working, but I had something to add on the employee and the employer aspect of trying to maintain a healthy lifestyle. From an employer's side, you want to be careful of what you're providing to your employees because, like mentioned, we're in a working town. Everyone's here to work, start a family. We also call it a baby-making town in the hospital because we have very high rate of pregnancies. And I say just a personal experience. When I first became pregnant, I was not aware of the resources I had available to me in town, but I was very fortunate that the place of work I was working had that resource is like a pamphlet of those given to me when I got pregnant. And my workplace let me know what my benefits were, what was available to me, what help I could get from my employer. And that was very helpful to guide me because most of the people living here are nuclear families, right? They don't have their grandparents, their communities around them. We're by ourselves. So we have to be very, very knowledgeable of what's around us and what's available to us. So as an employer, it's very, very important to guide your employees to what's available to them, what's financially feasible for them, and also giving them benefits such as what I get is a flexible spending account. Not everyone is like obviously lucky to have that, but I was. And when I realized that my flexible spending account given by my employer included chiropractor, like prenatal massages, and all of that, that was very helpful during my pregnancy. And also using that towards a healthy lifestyle, like a gym membership, I was able to do that and such. So that was very helpful that I got a lot of guidance through my friends and my employer. And I feel like that's very important to pass on to your employees. And also being mindful when it comes to healthy lifestyles, being mindful of each person's culture on your team and making sure you're very respectful of that, celebrating their cultures and being, very even. And that's very important to be fair with everyone. Like we can celebrate Christmas, personally we celebrate Diwali, you can celebrate Hanukkah. You can celebrate everything and make it so that it's a more even atmosphere. And then on the employer's side, it's also very important on how you use those resources, right? Like a lot of people are parents and have children, young children. Now, we have limited sick days. How you use those sick days is very important. Like a lot of parents sacrifice their own health and use those sick days when their children are ill, right? They don't use them for themselves. So try to be, as a team lead, you have to be more careful and be, mindful of that and be flexible with certain rules and like being more inclusive of all that is very, important. Because, like I said, this town is very special. The community that we have and the connections that we have are not all blood related. They're all like, similar experiences, similar ages, similar, difficulties in life. That's how we're connecting here, and those are the relationships we're building. So it's very important to keep those relationships no matter where you go, even in a workplace, keeping that healthy work-life balance and being fair to everyone, parents, single people, big families, small families, just being mindful of that here especially. Thank you.
Well, thank you for your insight and the panelists. I really appreciate it. I had a really quick question I wanted to ask that I thought of while you guys were sharing. How can us as students maintain a school-life balance? I know you talked about work-life balance and how at a certain time you're just able to put it away. But as students, we come home, we have homework to do, like tests to study for. So just wondering if any of you had any thoughts on that.
I'm a huge fan of time blocking and working in blitzes. So a blitz working is essentially working for 30 minutes straight without any distractions, and then taking 10 or 15 minutes to go do whatever it is that you want, and then doing another blitz if that's what's necessary. But also, if you're having trouble with getting like physical activity in, you have to schedule it. That's my personal opinion. Yep.
Oh, thank you. And we'll call on our next moderators.
So we're running out of time here, so I'd just like to skip our last questions and just ask the panelists to thank them for answering all our questions and ask them if they have any other messages to share with the audience to take away.
I just want to mention one thing. The most important part of being healthy is sleep management, and especially for, youths. We stay up late to study, to, scroll our phones or watch something on Netflix, and especially at that age, it's your mind is still growing, until you're young adults, like 20s. So you want to condition your mind to get rest. It's so important from early on to make sure you're getting good sleep, creating good sleep patterns, because that's how you're going to deal with stress. That's how your body is going to metabolize, everything efficiently. So sleep is very important at your age, and I would love to advocate for sleep no matter where I go. I said, if you can get your 5 to 7 hours of sleep, you'll be a much better person, you'll be a much better mother, you'll be a much better father, a sister, you know what I mean? And you'll retain more. Studying is a lot of science. You can't just study, and stay up all night before your exam. You're not going to retain much. Sleep, study, sleep, study, sleep. That's how your mind, puts it at long-term memory. And that's how you're going to be more efficient with your time, especially as students. So I feel like sleep is where you start for better mental health, physical health, and everything in between.
Thank you so much. Now I'll hand it over to Nishka to wrap this up.
I know. I work in a sleep clinic. Yeah. I work in a sleep clinic, and we have more and more young people with sleeping problems, not necessarily sleep apnea, but they have more sleep problems.
A lot more sleep disorders.
Like 20 years old, and they cannot sleep.
Okay, so let me conclude by thanking all of you for your time and valuable insights. Hopefully this discussion was beneficial for everyone. We look forward to welcoming you again for future events. A special thanks to Dr. Patel, our panelists, and the Multicultural Association of Wood Buffalo for giving us the opportunity to be part of this meaningful event. We'll end our conversation by a closing blessing from Elder Lorraine Albert.
Thank you. Maybe you can all stand, and since I took my hat off, you gotta take your hat off. Thank you. I'm very grateful to everybody that came here and to all of the opinions that were shared, and I hope that this day changes some of your opinions. And I'll tell you something really funny. I went to church this morning. I knew I had to come here, and I was thinking, how come the priest didn't bring it up about Human Rights Day? Boy, I was mad, eh? I was sitting there fuming through the whole service, and then when you said it was December 10th, I was like, holy, I was mad for a whole hour. Because he wasn't even worried about Human Rights Day, and I was like, just so mad, and I was like, oh my God, what's wrong with you, Lorraine? So I'm so grateful. Thank you, Creator, for bringing us together today. Thank you for all the people that shared. Thank you for the insight that everybody is expressing, and thank you for that little tiny baby over there that was so cute, and I teased her and I made her mad, and she got really happy and disruptive, and I love that. Creator, never ever let us forget that deep inside of us there's a baby, a little baby, a child that's happy, free, and loving. Thank you, Creator. Bless everybody here with a good week, and please let them all get a good night's sleep. Thank you.
I just have a question for you. Could somebody explain what is Medunity for you, please?
So we're basically like a bunch of students and we want to do something within the community, so we're like within a health organization. And so, like I mentioned before, some of our main goals was just like making sure that everyone has the right to like health and wellness and all age groups. But we do that by different things, so like workshops or things within the community or partnering with other organizations. So that's kind of what we do, and so yeah, we're just excited.
And you are college and high school students?
We're all, so there's grade 12, grade 11. So
Okay, good. Congratulations.
Thank you.
Thank you, everyone. There's still food. Please eat the rest of the food. Don't leave it here. I just want to say thank you again for everyone for participating today. We want to invite you, Canada College wants to invite you to International Day of Persons with Disability on December 3rd from 11 a.m. to 12 p.m. Be in Canada Main Theater and in the lobby. So everyone's invited to participate in that. We also want to invite you for our flagship event, February 1st. The expo is happening. Everyone come and be merry. It's going to be really, really good. Okay, so February 1st, it will be a Amaka lunch. Thank you so much. Enjoy the rest of the day. Don't forget